As a pharmacist, it is important to review the patient's data, medical history, current symptoms and signs, and medications to ensure appropriate and safe medication therapy. Some key considerations for medication review include medications without indication. Review all medications that the patient is taking and ensure that they have a clear indication for each medication. Indication without medication. Check if there are any medical conditions that require medication therapy that have not been addressed. Dose adjustment. Determine if the patient's medication doses need to be adjusted based on their medical condition, age, weight, or other factors. Monitoring adverse effects. Monitor the patient for any adverse effects associated with medications and provide interventions as needed. Drug-drug interactions. Check for potential drug interactions between the patient's medications and adjust therapy as necessary. Laboratory results. Review laboratory results to determine if any medication adjustments are needed based on the patient's kidney or liver function, electrolyte levels, or other factors. Duplication therapy. Look for any medications that may be duplicative, and consider discontinuing one of them if appropriate. DVT prophylaxis. Assess the patient's risk for DVT and determine if prophylaxis is needed. Calculate the Padua or Geneva score to identify high-risk patients and select an appropriate prophylactic measure. Stress ulcer prophylaxis. Determine if the patient is at risk for stress ulcers and if prophylaxis is needed. Select an appropriate medication, such as a PPI or H2 blocker, and monitor the patient for any adverse effects. Administration of medicines. Ensure that medications are administered correctly, following the prescribed dosage and route of administration. Confirm the patient's identity and check the medication label and dosage before administering the medication. Precautions. Consider any precautions that need to be taken when administering medications, such as monitoring for bleeding in patients receiving anticoagulant therapy or assessing for allergies or adverse reactions. Monitoring. Monitor the patient for any adverse effects associated with medication therapy and adjust therapy as necessary. Consider checking vital signs, electrolyte levels, blood sugar levels, or other parameters as needed. Feeding. Assess the patient's nutritional requirements and determine if enteral or parenteral feeding is needed. Monitor the patient for any complications associated with feeding, such as diarrhea, constipation, or infection. Analgesic and sedation. Determine if the patient is experiencing pain or anxiety and select an appropriate analgesic or sedative. Monitor the patient for any adverse effects associated with the medication, such as respiratory depression or excessive sedation. Hyperglycemia and hypoglycemia. Monitor the patient's blood sugar levels regularly, especially in patients at risk for hyperglycemia or hypoglycemia. Adjust medication therapy or provide glucose supplementation as necessary.